about my project now. And the first thing I want to ask you is what is the main purpose of any product, especially new product, when it's entering the market? Who has any guess? Anyone? Yes, please? Yes, or elevate value for the potential customer. So what we are trying to do, we're trying to elevate this value for the patient in need of healthcare services. And to better understand what we are doing, please look at the short video we are having here. Where is the...
You just need to do it from the laptop because it's
here.
without the clicking, sorry, just with the...
Okay.
Every year, people around the world pay as much as $800 billion for medical services from their own pocket at the time of necessity. When such a need comes up, the most important resource is time and the expected outcome. Smart Medical Contracts from Robomed Network is a comprehensive technological solution to meet the urgent demand for medical services. The patient chooses a smart contract by the type of his problem, and then the Robomed Network system navigates the client and the healthcare provider through the optimal clinical guideline. The clinical guidelines used by Robomed Network is the result of the collective work of the best specialists in the professional medical community, like ICHOM nonprofit organization, an association based at Harvard University. Healthcare providers involved in smart contract fulfillment receive reimbursement only if the measured outcomes prescribed in the smart contract have been met. Thanks to the Robomed Network service, the patient receives value-based healthcare in accordance with the best world practices, wherever in the world the patient would be.
So this is the main idea of what we're doing. So we're doing a smart contract ecosystem. Smart contract ecosystem to support value-based healthcare around the world. And this is our team. So we have a multinational team from all around the world, and we have successful entrepreneurs like me and my partner Ivan, who already built scalable business models in healthcare in our home region. So I particularly own a network of hospitals. We have 5 hospitals right now, and Ivan was involved in building the second largest player of laboratory diagnostics in Russia. So we actually know what we're doing in the market, and we want to show you that why
That's for the wrong computer. You have to do it manually.
Okay. So, we have a strong advisory board. We have a Harvard Medical School professor, Thomas W. Philly, who actually consulted us on all the structuring of our medical part with smart contracts and clinical guidelines. We have financial institutions backing our frontline talks with investors, and we have guys from tech companies who advise us on how better enter emerging markets and develop our infrastructure there. So let's speak about the market and why we chose the particular size of the market for our project. So all the market is around $4.6 trillion, and we chose the target market for ourselves as emerging markets, where it's around a third of the market share, and the particular problem in this region is that their per capita expenditure for healthcare is not enough, not sufficient to have sustainable level of education and human resource management in hospitals. So according to West European standards and clinical guidelines. So actually they cannot develop the needed institutions in their regions to have that level of medical staff education and process management as they do in North America or Europe. So we decided that in this region, our business model will be having a great success, because they actually have a paying out-of-pocket demand in around $800 billion in this region, of people ready to pay their own money to elevate the value they receive from healthcare. These people even pay hotel and air tickets to travel abroad, and still pay out of pocket for their medical services in developed regions like North America. So they even pay much more money than average European citizen without an insurance plan to get that value of care. And what we suggest is we have a marketplace with the smart contracts, and we pay the healthcare provider only when the outcomes and the events that should follow a particular treatment are met. And we have all this measuring system in the blockchain, and we ensure that this system is transparent, and that there is no any non-medical value adding parties or middlemen involved. So if the healthcare provider doesn't meet the outcomes and the needed events that should be done throughout the particular treatment, this money is refunded to the patient. So to support this kind of ecosystem, we developed three IT products. First one is the cloud AHR system that is blockchain inside the hospital. All the personnel of the hospital are working in this EHR system. We mark and tag all the process, all what they do inside the AHR system, so that in the end we can particularly say that were the events subscribed to particular smart contracts met or not. Second is application for a patient, is a mobile application, and it serves as a gateway to all the services that we can provide through our network. And this is particularly the wallet for medical data of the patient and for controlling current smart contracts that this patient is acquiring. And the third product is a medical knowledge base that is used as a basis for a smart contract, and which consists of all the clinical guidelines needed to create such ecosystem. And altogether, combined, that lets patient control his medical data. This lets us support smart contracts between all institutions inside the ecosystem. This lets us unite all the healthcare providers with a similar goal to achieve value-based treatment for the patient. And the question is, where do we get all these guidelines? How we make them relevant? How we make them up to date? So this is the idea of a decentralized community management. We have a medical community with the core IHM organization. It's a non-profit organization that particularly serves the same cause as we do with these clinical guidelines. And we have a patients community that votes for which clinical guidelines should be digitalized in the system first. So we have a little tip on how the demand works for particular treatment cases. And the doctors in the medical community, they receive reimbursement for voting for clinical guidelines and contributing their knowledge for the common good. So we had the review in Harvard, so this professor then joined our cause, and his main conclusion from this review was that this project can be disruptive for the targeted markets. The business model is commission from payments that come through our system. So we receive the money from patients and we transfer them to clinics and serve in this transaction as an escrow, so that we make sure that smart contract is completed by the clinic for the patient's money, and we just take a little commission for doing this job. And here you can see the distribution of revenue from this commission. We actually already have a revenue. We have 20 clinics connected, so our next slide is like the background we're having right now. So we started the project in early 2016, and we already have our 3 software products developed. We have 20 clinics connected, really using our cloud EHR system and contributing their knowledge and data for our cause. We have 1.7 million clients already in the database with their medical records. We have 2,900 clinical guidelines that we have digitalized with our team and that are available for purchase of smart contracts. So, and actual doctors are really, right this moment, are getting paid for completing smart contracts throughout our guidelines. So this is a reality. We can even share with, after signing NDA, we can share the data that we receive, how different hospitals and different doctors are really achieving to complete smart contracts. We have that data already. So this is really interesting because different management in different hospitals really have a large gap in how they manage to do that. Our main system technologies are FHIR protocol for our medical data because, as mentioned before, this is really a huge problem. But in the development markets, there are still a lot of clinics that don't use any EHR system at all. They use paper, or they still have some really dead-end EHR system that was never supported for like 5 years, or they hired just one program guy and he's coding something nobody knows what. So this is a really free market for such a product, and when you guarantee the clinic that you will give them money, you will give them patients, and you will help them manage their doctors, they really don't have much hesitation to switch to your product. So we have global data analytics tool because from all this information that we're gathering from different healthcare facilities and gathering it in a similar data format, we can have different meaningful insights on the population healthcare situation, on the management lifestyle of a particular clinic. So this is a huge asset. And we also have open API for any DICOM or laboratory information system or website. We can connect all that through our open API. We already have that built. You can go to our website and go through the API we have. What we're really trying to achieve is build an ecosystem that different application providers can connect and develop their patient engagement application or a web service and get used to all this simplified and unified database. So right now we're in our roadshow, and we are starting our pre-sale ICO on 25th of October. And what we're planning to raise is 100,000 ETH. So to get the product scale up in different regions of the world. So please feel free to join our project on our website. And thank you for your attention.
Thank you. So I'll kick off.